Hi, everybody. This is Joel Wood, your lobbyist here in Washington. Congress is out of session this week, but it was a busy week for an important week for brokers insofar as the Department of Health and Human Services on Monday finally released its interim final regulations governing state-based exchanges. And I would say, on the whole, it was very, very good news for agents and brokers insofar as HHS explicitly identified that states have the flexibility to be able to engage agents and brokers on multiple levels, not only in the enrollment of individuals in state-sponsored exchanges, help them determine whether or not they qualify for subsidies and tax credits, to afford states the opportunity to highlight agents and brokers on their website portals, to allow agents and brokers to be able to participate in the governance of state-based exchanges, and to allow agents and brokers to also be afforded a role with strict conflict of interest rules that are understandable as part of the Navigators program to more broadly help sell the exchanges. I was on the phone this morning to one of our members, Phil Edmondson, frankly, at William Gallagher in Boston, and he noted correctly that there are still great opportunities for states to spectacularly fail on the development of exchanges, but also exchanges, if they're treated like a true residual marketplace, there's an opportunity for them to succeed. The consumer groups, in particular, this guy, Tim Jost, a Washington Lee law professor, who has been a relentless critic of agents and brokers, immediately criticized these regulations and said that they would, consumer groups would seek to change the final rules in the 60-day comment period. And I take that, frankly, alone as a pretty good sign. There's no assurance that all of these HHS regulations, and frankly, great comments from HHS about the value of having brokers out there engage with clients. There's no assurance that this means that the states are going to be able to do it right. It doesn't mean that agents and brokers are going to have a vibrant role in every state-based exchange. But it does at least acknowledge and reassure us that that role is envisioned by the federal government. It gives the states a lot of flexibility. With all of the uncertainty associated with it being a presidential election year, with the Supreme Court case, clearly, politically, HHS was trying to reassure the states that they'll get more and more flexibility. Republican governors continue to criticize HHS for saying that the federal exchanges, they've yet to give guidance on how that would work. What qualifies as a minimum health plan, a minimum essential benefits, a lot of unanswered questions, but I would say on the whole a good development this week. Hope you all have a great rest of the week. Thank you.